Eastern Cape's Premier is establishing a team to improve its COVID-19 response. It follows criticism that the province's health system is buckling as coronavirus cases there increase. The team comprises of medical experts and administrators. Premier Oscar Mabuyane, spokesperson Mvusi Sicwetsha, joins me now. Mvusi, thank you so much for joining us. What else to ask, if you're having many issues now, what were you doing during the lockdown period where you were supposed to prepare for this eventuality?
We did prepare for the eventuality. That is why we have a long-term plan of procuring PPE. That is why we have got 22 health facilities having been renovated. That is why staff in the front line of health staff in the front line has been trained on infection control, on top of the basic training they get, whether nurses or doctors. What we are seeing now is the impact of the surge and some of the administrative problems in the health system that predate COVID-19. So what the Premier has done, when people continue to raise these issues, he sent a team that was made up of doctors and administrators to look at the situation at the health facilities, to look at three things. One, the clinical capabilities of these facilities. Two, the administrative processes that should be able to make a clinical provision of clinical health care to be done easily. Three, to look at the issues that are raised by labor. So your issues of infrastructure, facilities, and all that. So he has put together this team, then the project management unit, to address all these issues. The issues of providing oxygen to all hospitals. One of the things they picked up, for instance, was that the lead time for providing oxygen for hospitals far away from PE, where gas supply is causing problems in some of our hospitals. So they're now going to look at issues of sourcing oxygen for districts like OR Tambo and Alfonso, from provinces like KZN, which are closer to them. Also, the use of the Chabulani Winfield Hospital by private and public health sector hospitals, where they're going to provide to transport patients that are in these hospitals and their health workers to use that facility, which has got more beds. So what the team is going to do is going to address the problems, administrative problems also that saw actually the delays in procurement and the appointment of management and other personnel in the health in the public health hospitals. So these are the things that have been frustrating the health intervention of facilities.
So Mvusi, that's what the team is going to do. But we can go online. There was a report done by another news channel, a world news channel, and they were speaking to some of the health professionals in the Eastern Cape. We've got one medic calling it an epic failure of a deeply corrupt system. Those are the your medical staff saying that about your system in the Eastern Cape. I mean, that's got to be a drain on staff morale. What are you doing about that?
Look, part of the reason the Premier took this step was because he listens to what people are saying. So the team was looking into those issues, and they came up with solutions to the problems that were raised. And he's saying those that know of corruption in all our hospitals, in all our institutions, they must report the incidents of corruption so that government will be able to pursue charges against those that are alleged to be corrupt. But the problems that we have picked up are administrative problems where there are unnecessary delays in processing appointments, in processing procurement. I mean, it should not take a week to fix a bulb in hospital, to fix a broken window, to fix drainage system. So the team has looked into that, and this now becomes a priority of the task team to ensure that there are systems that make it easy to fix problems, to address issues of labor or of labor unions, to ensure that when people are raising concerns, those are responded to promptly. You don't have delays unnecessarily.
Mvusi,
Mvusi, work with government in addressing these issues.
I hear you calling on the workers to work with government. I just want to ask you, just how bad is it there in the hospitals in your province at the present moment? And here I quote that same report that I was talking about here. They're saying nurses are forced to act as cleaners. There are reports of unborn babies dying in overcrowded, understaffed wards. Are you having staffing issues? Are nurses, moonlighting as cleaners at the present moment? Is that Are those facts?
But this is one of the problems why we have decided to send the Deputy Director General to these districts and metros to address these problems. And the team is working with the unions now to ensure that all concerns that are raised by general workers are resolved. But government is calling on everyone to ensure that the ethical responsibilities that we have to the patients are always prioritized. Government is here to listen to all the issues. Workers should not desert their responsibilities because of the issues that they are raising. Government is listening to those issues. Let's all work together to protect the patients, to ensure that doctors are focusing on healthcare, nurses are focusing on nursing, general workers are focusing on providing support to these teams. And that's why Premier has approved the report, the long-term procurement report of the Department of Health, to say these are the aprons that we're going to need, all the items of PPE. And we, as a result of this intervention, now we have a surplus of 1 to 2 weeks, and we continue providing more PPE to all the health workers so that they are safe and they're able to provide health worker support. The army is also there in these hospitals, and they're alleviating a lot of pressure that was there before. The mortuaries in the hospitals are not overcrowded as some are claiming them to be overcrowded. So government is ensuring that the provision of healthcare is not hampered by anything. So that's why this team is coming in, because it's a team of experts that are capable of turning around any situation.
All right. Thank you so much for speaking with us there and clarifying a few issues there. That is Premier Oscar Mabuyane, spokesperson Mvusi Sicwetsha, talking to us there from the Eastern Cape.